You're listening to Dr. Erica Jones, MD. The universe needs conscious minds to observe it.
Open enrollment is here. And if health insurance feels confusing, you're not alone. Here's a quick, no nonsense guide so you can actually pick the right plan this year. First thing you want to do is start with your total yearly cost. Most people only look at the monthly premium, but that's just one piece. You have to be able to look at the complete picture. And here's what really matters. You have to look at your premium. This is going to be what you pay every month to keep the plan active, even if you never see a doctor. Another thing that you want to define is deductible. A deductible is the amount that you have to pay out of pocket each year before your insurance starts sharing the cost for most of the non-preventive care. Another thing you want to consider is your out-of-pocket maximum. This is the hard cap on what you'll pay in a year for your covered care. And once you hit it, the insurance pays 100% of the covered services. You need to know what the covered services are. So here's a tip. Take 12 months of premiums and add your likely out-of-pocket spending. And that total yearly number is the best way to compare plans. So don't just consider the premium. Other thing you have to do is understand the cost sharing terms. Now, what that is going to look like is kind of dissecting what a copay actually means. A copay is a predictable flat fee. Let's assume like you might have $40 to go see your primary care physician. Co-insurance is different. It's a percentage of the bill after you meet your deductible. Like if you need an MRI and you pay 20% and your insurance pays the other 80%. High deductible health plans usually have lower premiums but higher upfront costs. And the upside is they might let you use a HSA or a health savings account. So it's important to actually look at all of this stuff. You want to check your network, especially if you have a favorite doctor. Cost is important, but access matters just as much. When you look at the network, it's the doctors, the clinics, and the hospitals that your plan contracts with. If you go out of network, that can mean that you have much bigger bills or absolutely no coverage at all, and then you're going to be forced to pay out of pocket. Now let's talk about the types of plans. HMO, they're usually cheaper, but you need a PCP and referrals. Now PPO might offer more flexibility and out-of-network options, but the premiums might be more expensive. An EPO means you have no out-of-network coverage, but often you might not need a referral for your coverage. So before you enroll, make sure your PCP, your specialist, and your preferred hospital are in network, or you could be in for a big surprise when you go for your follow-ups. Now, some of the other things you can do when plans may look a little similar is to check the quality ratings and their member satisfaction. Now, quality ratings are based on preventative care, chronic disease management, and overall health outcomes. And then when you look at the satisfaction scores, these are pretty much showing like how well the plan communicates, resolves issues, and supports its members. So you have to really put in time to shop for your insurance. If your costs are close, then these scores can kind of help you break a tie in deciding what you want to choose. And the last but not least thing that you really have to focus on is find benefits that fit you. Look at all the details of the plans that affect your actual health.